Okay, so we are live for our latest episode of the series that we're doing, the London Autism Group Charity is doing on the topic of mental health and well-being and coping during the COVID-19 pandemic for the autistic and wider autism community. And we're delighted to have today on the live stream two fabulous researchers all the way from Belgium, no less. But you're going to tell us that you're actually Dutch originally. So we have Danna Oomen and Dr. Annabel Nijhof.
Right.
Is that right?
Yes, perfect.
5 out of 10.
Okay. No, perfect.
Okay. And James, how are you doing, James, today?
Yeah, we're good, thank you.
Yeah, how's Daryl doing?
Yeah, we're happy to be here. We're both good.
Great. So we have specifically invited Danna and Annabel because they have completed a really interesting and quite large cross-national survey on the impact that COVID-19 has had on autistic people, and in particular when it comes to autistic people's mental health and well-being. And what's interesting is that you collected a lot of data, right? And you also collected data from a really nice comparison group of non-autistic people, so you can really draw the differences. And mental health, the impact this pandemic is having on the community is what we're all about. And it'd be really interesting to just hear about what you found and talk about what we can learn from it, what we can do, perhaps what we can action. But first, maybe if you guys could just briefly introduce yourselves and we'll go from there.
Yeah, sure. First. Yeah. I'm Danna. I'm a PhD student. I'm currently in my second year of my PhD. And normally when I'm not researching this topic, I do autism research, and I specifically look at how the brain processes social interaction stimuli.
Okay. Sounds very complicated.
It's fun. I do something a little bit similar. I'm Annabel. I am a postdoctoral researcher at Ghent University. I also did my PhD in Ghent, but after that, I actually lived in London for 2 years.
Oh, right. Okay.
Where I was a researcher at King's College. Postdoctoral researcher at King's College. And my research mostly focuses on autistic adults, and specifically processing related to the self and others. So how do we process things that are relevant to ourselves and things that are relevant to others, and how may this differ between autistic adults and non-autistic adults?
Right, okay. And you're originally both from Holland, right?
Yes. So we grew up and studied in the Netherlands, and then somehow both ended up in Ghent, but that's entirely, I guess, a coincidence.
Yes.
All right. Okay, cool. So, we're really keen to hear about this research that you did. So, do you want to just tell us a little bit about, the aims and objectives, when it started, some of the kind of the broader sort of picture of the study?
Mm-hmm. I think we started right at the beginning of all the restrictions. So we started to work from home. And to be honest, I felt a little bit like my research became a bit trivial, like not really important at that moment, because everything was so fresh and I lost my routine. And then I was wondering about how the autistic community was dealing with it. And then I hit up Annabel to ask if we could maybe research this to see if we can find out how they are handling the pandemic. We can share the results, and then hopefully people will actually benefit from them just by sharing the information. Yeah, that was the idea.
Yeah. So then I guess after we got the idea, we kind of thought, okay, what do we need to know? What does the autistic community need to know? And well, I think agreed that the main aim was to see how are they coping in these times, and more importantly also how can the community or the people surrounding them support them through this time. So what can be done better, what can be changed, or like sort of signposts, flags, like what is particularly difficult for people so that we can pay more attention to it. I think then by the end of March we had put the survey online, and it's been online for about 1 month. So we have made sure to get a lot of responses and to spread it widely in 3 different countries.
I really like that you took a multinational approach. That's really good. And you've, to my understanding from what I've read, you've sort of looked at whether there are differences in what you found between the countries compared to as a whole, and there aren't really that many differences, which makes it kind of, technical term I suppose is homogenous, right? It makes it, comparable, which is really nice.
We weren't quite sure because, of course, the countries have a different approach in how exactly they apply the rules and how strict they are and the political situation. So we were, curious to see, but at least for those first results that we now report, there doesn't seem to be a huge difference between Belgium, the Netherlands, and the UK.
Yeah. That's really, I mean, that's interesting in itself, isn't it? But before we launch into that, just hello to Ria and Sakina. Hello, Sakina again. Ria, you are a SEND practitioner. So yeah, special educational needs and disabilities practitioner. Well, welcome to the live stream. Please feel free to ask your questions or comments as we go along. Okay, so I think it's great that you had this idea. I think obviously this really resonates with us. James and I had the same thought. So we run the charity, but when this happened and it became apparent, life was going to be changing quite significantly with the lockdown, it really hit us hard as to the fact that this is really going to affect the community. I mean, there's going to be this, a lot of anxiety. I mean, the interesting thing about it is that, well, not the wrong choice of words. The challenging part of it is that the autistic community already struggle at a much higher rate than the neurotypical population when it comes to mental health anyway. So they're at a baseline level already quite vulnerable. So this is really risky. Was that your thinking as well?
Yeah, that's why we chose to include questions that are particularly asking about change. So change from before the pandemic till at the moment they were like filling in the questionnaire. And then when we found that autistic individuals experience more anxiety and depression related symptoms, it also became clear that it's on top of what they already were experiencing before the pandemic. So that's particularly worrisome, I would say.
Yeah. Yes. Yeah. We've got a couple more comments coming through. Amy Perkins. Hello, Amy. She's also a SEND teacher. So hello. It's great to have practitioners and teachers listening as well, because, we want to try and make the results count for something. If we've got people on the ground actually working with children and adults, then, this could play, make a difference. Sakina, I hope this group goes along a very helpful, extremely supportive group. Thank you so much, Sakina. Yeah, maybe we'll do that. Maybe we'll see how it goes. Yeah, I'm glad you're finding it helpful. Okay, Anna, you're asking, without people have got their ID stressed out in the winding myself up and stressed about a lot of things. Okay, there's another comment here. How do you get rid of the pity? I don't anything with my stressing me out. I would like to leave here, goes to live somewhere else. Okay, obviously, Anna, then it sounds like you're really struggling with the stress of the situation. And, I think the results of this study really align with that. Do you want to talk us through what you found a little bit? Maybe some of the key things? Exactly.
Yeah, the key thing I think is that for both groups, so autistic individuals, but also people that don't have autism, they both experience an increase, or about 75% reported an increase in anxiety and depression symptoms. And that increase was higher or greater for people for autistic people. And then next to that, we questioned about worries that they have at the moment. And then some worries were more there for autistic individuals compared to people without autism, such as worries about their pets. We're not completely sure why they worry more about their pets, but it was one of the findings. And then another worry was about following the rules correctly. Also, because sometimes they are a bit vague, the rules, so that stress that can induce stress. And then another thing that isn't really surprising when you think about it, it wasn't something we thought about before, I guess, was that grocery shopping is particularly stressful at the moment.
Yeah, and this was really mentioned by a lot of people, because we also had some open questions at the end of our questionnaire to more widely see if there was anything we missed or anything that people particularly want to highlight. And the stress surrounding grocery shopping was something that was really, really mentioned a lot. And for two reasons, we basically saw it was in two categories. One was, other people in the shop, they're not quite following the rules. They come too closely. The aisles are too narrow. And the other thing is that items are not always available. So some items that people are particularly attached to, they are suddenly not there anymore. And just anything being different, really.
I guess we all have kind of a routine when we go shopping. Like, I wasn't aware of mine, but I have one too. And now you suddenly have to stand in line, have to be aware that you don't put things down again when you grab them. And
I mean, the shopping one is something that's come out quite a lot during some of our interviews and just our interactions with the community generally. I think you touched on some of the key reasons. I mean, one of the main ones being that there's often a reliance on particular items being available, and those items really, centering and regulating people isn't just about nourishment per se. I mean, often it is, but the sort of, the sort of concreteness of it, almost the predictability of it, in daily life, and that sort of not potentially being there is obviously going to cause a lot of anxiety for those people struggling on that front. But then the other thing is, I was thinking about this shopping thing. So you mentioned about people not following rules, and there's people stressing and being anxious about that, and then also in your results you talk about shopping being quite stressful because of the social distancing rules as well, and sort of confusion that comes with that. But the other thing about it is I think sensory. Shopping is a very sensory heavy experience.
Mm-hmm.
I mean, it's very, there's lots of echoes going on, lots of bright lights, not just the sound and lights, but the architecture of the building. It's very sort of quite intimidating almost, sometimes.
And this is already the case in usual circumstances, but probably now that, there are some, I don't know, every shop also goes about it a little bit differently, but in the shop where I go, there's someone at the entrance who hands you your basket and asks you to spray your hands with a sort of hand sanitizer. And, if you had the sort of idea what shopping is like, it's also suddenly completely, there's a lot that comes now on top of what is already quite a sensory overloading experience for many, probably.
Yeah, things like queuing up in line for a lot longer, more sort of interactions with the staff of the shops, and a lot more restrictions involved.
Yeah,
and
the social interaction is now also very different. Well, our people are wearing masks, so you can't really see if they're smiling or not. We also heard quite a lot of people saying that that they usually have some trouble reading people's faces, and that they really worked hard to get the cues, and then now they are kind of lost again.
It was interesting you mentioned pets, because for me, I've seen I know a lot of autistic people, and most of them have pets, and the bond with their pets is absolutely amazing. You know, it's like a parent with a child. So I'm not surprised that came up so much, because it's an enormous benefit to mental health.
Absolutely, yeah.
And having that under threat, having that under threat, it's like worrying about a family member. You know, it's the same thing.
Yeah.
I mean, the other thing is that, there's this wide, awful misconception that autistic people don't have empathy, or they lack empathy, but when actually it's often the other way around. They're often very, very empathetic, and I think it comes out with pets. That's, they have a very, very extremely strong emotional connection. And
because you've got the sensory connection,
yes,
with touching, and that kind of thing.
Yeah.
So often people who are quite challenged, and their moods can get quite low and things like that. They will turn to their pets in those situations, and they'll regulate their senses through their pets and find an equilibrium through that. So there's an incredible bond that happens.
Yeah. That's beautiful. Let's hope they can still also find a lot of support from their pet throughout this period, even though they may also worry a little bit more about them. But yeah.
Ria, yes, she's correctly pointing out that some supermarkets now have autism-friendly shopping hours. Yeah, that is the case in the UK, although it's still quite limited and not entirely reliable.
Our end, it means getting up very early in the morning. So it's not always reliable.
Yeah. What did you?
Yeah, from the answers we got, it was some supermarkets have that, and then some don't, which is also a bit confusing. Like,
it's a good point.
Yeah, but it is a recommendation that we made at the end of our report, because it is such a big issue. Maybe some more supermarkets can consider it. Some hours that would be autism friendly, less sensory, like maybe dim the lights a little bit, and make sure that there are less people in the shop, turn off the music, things like that could make it a much less stressful experience, maybe.
Yeah, definitely, absolutely. I think also it sounds to me like it needs to be quite quite sort of driven by wider sort of social policy in a way, to make sure there's consistency, regional consistency, as per your point, that if one supermarket's doing it but another's not, that confusion can cause a lot of anxiety in itself, right? You go one morning to the supermarket not entirely sure perhaps whether it's going to be right.
Yeah, and also spreading the information, because I think for lots of people it's very unclear, and they really have to actively search for it, like information on how it exists for people and in which supermarket then. And it's a lot of trouble you have to go through, I would guess, in already a very stressful time.
Yeah, I mean, the whole shopping thing really is a key issue, and then I just feel like, at least in the UK, it could have perhaps been handled a lot better. Now you look back and we know better, although we could have predicted a lot of this. I mean, if they spoke with the the autistic community and some of the, you know, the experts who lived this life, you know, they could have, I mean, they could have predicted a lot of this.
Yeah.
So anyway, we've got a nice comment here from Robin Yellowlees. Really interesting talk so far. Thank you, Robin. I agree. I would be interested if you knew how people with autism in your survey are coping with the social isolation or home working aspect in comparison to others. Did you look at that?
Not necessarily homeworking, although lots of people mentioned it in the open answers. But the social isolation, I think there is some kind of stigma that people think that autistic individuals have less need for social contact, which may in some cases true, but we found that most people also suffer under the social isolation, especially because it's not a choice anymore. Normally, you can choose yourself, like, okay, I need some little me time for my own mental health. I don't want to socially interact as much, but now it's kind of the choice is taken away from them. And they need it too.
Yeah.
Yeah, like everybody needs that. I mean, I think you're right though, Donna, when you said that it's a misconception about, you know, people, autistic people, not wanting social interaction. That is a huge misconception. Everybody wants, you know, to feel loved and to be loved, and that it is itself through social interaction, right? So everybody wants social interaction. It's just that it's often quite sort of anxiety provoking and challenging, so that it's just, you know, maybe a particular difficulty, you know, given all of the nuances, the sensory things going on often during conversation. So it's a challenging thing, maybe more for autistic people in some ways, but it's not that they don't want it. You know, in fact, they might need it more actually, because they suffer from so much exclusion and loneliness and rejection.
Definitely.
So actually they need it more. Yeah, sorry, James, go ahead, mate.
Yeah, definitely. I've recently done a piece for a book about a study about autistic identity, a contribution to that book, and I talked about the differences between autistics trying to connect with neurotypical people and autistics with autistic people. And I think one of the things that helps us connect better with between autistic people is we connect through our interests rather than just using small talk, which we struggle with. So they're sort of our I think we connect better we sort of formed our own sort of community between autistic people. So I think we connect better between between each other, you know.
Is our mic muted? Because it's saying that we got muted.
Yes, I was manually muting it just to test, just because I could hear a little bit of echo coming out, and I thought I was trying to isolate the echo, but it's very minor. I wouldn't worry about it. Don't worry.
Okay.
You caught me. You can't get anything past scientists, man. I'm telling you.
Yeah, it's a very important point that it's so misunderstood, and I think that's also one of the things that we wanted to communicate, maybe in this case not so much to the autistic community, because but more to the wider community, that, you know, maybe we assume that autistic individuals don't need to be checked in on in these times because they're actually enjoying it, but we want to show that no, actually in one of the questions, in one of the open questions, we asked what can be done to help you manage your mental health in this period, and a lot of people said it would be nice if someone just occasionally checked in. And I can say that today I'm not really feeling like talking, but at least if someone is checking in, you know, I know that I'm not being completely isolated. I know that I'm not being excluded of anything, and just checking in sometimes can be enough to know that
I think there's probably a difference there between families who live together because they've got that support there. But people living completely on their own, it's something different again.
Absolutely.
So, because I've heard from families that having their autistic children away from school has actually taken the stress of going to school away from them. They're quite enjoying that side of having a break. But I live on my own with my son, and I can tell you, I don't like the isolation.
No, but it's a very individual experience, because we have also read examples of parents that are feeling a little bit overwhelmed that now they are at home with their kids and having to teach them things while also still having to do their own work or work in the house. So it's difficult to find the right balance these days, I think, between too much or too little social contact, maybe.
I think we saw in both groups that people missed, when they had families, they miss a little bit of just me time, like a space they can be by themselves.
I think
I'm just looking at your report, and you do have a really nice quote on this particular topic. If you don't mind, I'll read it out. So the quote is as follows, and I think it's from an autistic person.
All the quotes are from autistic individuals.
So the quote is: "The stress of not being able to see loved ones outside the house and feeling crippled by social isolation with no idea when it will end. I feel a neurotypical person in this situation will have a vast number of people to interact with in varying ways. I have 2 who I'm in touch with outside my family, and only 1 via Skype. As an autistic, I have a limited social circle, and now it's even smaller. I worry about autistics who live alone consistently too." I mean, that's really interesting, isn't it? That's an interesting perspective.
The answers that we got, like, it was a emotional roller coaster to go through them. Like, they put it so beautifully, I have to say. Like, those quotes really
quite open and personal. And I think in this example that you read, it was also really nice to see that, they're describing, I don't have a very large social circle, but the ones that I do have, they're very important to me. And we do miss each other and want to reach out to each other a little bit more in these times. So I think in initiatives like your community and other things that we've seen, they're very important, I guess. So
Thank you. I mean, I agree. I do agree just on this point again about social isolation, interaction. You said something that I think is very important, which is it's a very individual experience. There's a lot of variability. And while I think a lot of people are going to be struggling with this because of quotes like the one I just read out, there are also people I've heard who are actually, perhaps experiencing less anxiety as a result of the whole situation, because now perhaps there's less unpredictability. They're at home in a safe space that they know very well. They're comfortable with a new routine that they can construct living in their safe space, and all the sort of anxiety that comes with daily life of interacting with people who might cause you a problem or misunderstand you, or all the rest of it kind of is reduced. And so I've heard actually a lot of people say, okay, I might have fewer people to speak with, and there are problems, but at the same time, actually, I feel a little less anxious than I might have. But again, it's variable, isn't it? It's going to depend on the person.
But a lot of social stressors disappeared by the pandemic, I would say, like by self-isolation. Like at the one hand, people also need social contact. On the other hand, all the obligatory things, like the obligatory social contact, they kind of disappeared, and that's a stressor that is taken away by that. So you don't have unexpected visits anymore, or people keep their distance a little bit more when they're talking with you, which can be, by some people, seen as a positive from this.
But I mean, I suppose though the evidence speaks. You know, you can't get away from the evidence. I mean, your study found that approximately 3/4 of your sample. How big was your sample again? It was like several hundreds, wasn't it? I can't remember now. It's 600.
We had almost 600 individuals with autism and somewhat less without. So the autistic individuals were almost 600, I think, that filled it out. And of those, 3/4 approximately said they have an increase in stress-related symptoms, and maybe the other 1/4 it stays either the same or it's less. There are some individual cases that say, I'm loving this, but they are in the minority actually.
I mean, I think we should, just take a moment to sort of really sort of realize and comprehend that meaning. 3/4 of your autistic sample, and that's a large sample, right, across different countries, reported an increase in depression and anxiety as a result of the pandemic, not necessarily tied with any one thing, such as social isolation or something else, but as a general response for whatever reason, whatever their individual reasons were, it's increased their depression, anxiety. That's really sad, isn't it? That's really powerful.
Yeah. I don't think we were really sure what to expect when we started doing this, because of the mixed stories that we were hearing on like an individual basis. But as we said at the beginning of the talk, especially when you consider the baseline is already that autistic individuals are experiencing more mental health related difficulties. The fact that these are increasing, particularly for them, that's something to be very aware of, I think.
So what does this mean then going forwards? I mean, what are the what is the implication? What do we need to do about that? I mean, we can't just ignore that. I mean, that's an incredible finding, isn't it? That 3/4 are reporting increases when the baseline was already so high. There needs to be some action, right? Or something, some work done to try to reduce it, because that depression, anxiety, if you're experiencing significant levels of that just destroys your quality of life and your general well-being, sense of well-being, and can lead to, I mean, I've seen some stories of suicidal ideation and attempts, unfortunately, in the autistic community and also other populations. So it's a big problem. What do you think? What do you think we need to do about that?
So what we wanted to do now with this study is bring some awareness, and then also, of course, we added the question what people are needing right now, and I hope people can just listen to the needs that we described. So one of the needs is to have continued support. So a lot of people reported that they lost their support due to the pandemic, or decrease. So maybe they were seeing someone like once a week and now it's less. Well, it's actually a period of time that people needed more, even people that didn't need it before.
I think so the awareness is very important. The continued support is very important. Anything that can be done to take away the sudden stressors that there are. So anything related to shopping, the checking in with people is another very important one. So just checking, do you need something? Can we do anything to relieve your stressors? Can we go shopping for you? Can we do anything to take away some of the stress?
And I think another thing is, I think here in Belgium, they're kind of lifting up some of the restrictions, and I think that's gonna happen or is happening in England too. I think it's very important that people reported also to have anxiety by the thought that things are gonna change again. And it's probably not gonna be a sudden change. It will be a continuous change, and it's continuously adapting to new situations. And you can kind of see with the results that people struggled a lot with the sudden change. So now knowing that they struggle this much, like being aware that they need help now that things are going to change back to normal again, and not thinking like, oh, but things are going to be back to normal, so it's going to be fine again. No, some help with that would be, I guess, really.
Wow, that's such a good point. There's a really, really key point. The need to support the community with the transition to the new. I mean, transitions are always well, not always, but often a struggle, or something else that's quite challenging for the community. I mean, you know, routines are regulating. They're safe, they're predictable. You know, and so whenever there's a change and a transition to something, often a forced transition in particular, it's particularly anxiety provoking. So you're absolutely right. I think that's a really, really good point. So hopefully there can be some really, you know, really, really sort of effective COVID-19, you know, tips and strategies that are put out by you know, governments and services as to how people can deal with the changes and transitions, I suppose. But you know, what's crucial is not just the quality of the documents and the tips, but also getting into the communities, you know, and you know, getting the messages out there. That's a crucial point. I mean, something in the UK, just this is a bit off topic, but in the UK, with the government, our government has had a lot of criticism about that, in that a lot of their messages have been quite population generic, let's say, and not targeted to BAME communities, you know, Black and Asian and ethnic minority communities who've actually really struggled with, who've really struggled with morbidity and mortality much higher rate than the white population. So part of that is, okay, you know, we have to sort of work with the communities. So that's going to be a really important thing here too. That it's not just about the messages, but it's about the route to getting those messages heard.
Definitely, yeah. And the messages have to be clear, but they also have to be targeted to the specific population that you're talking to, and make sure that it reaches them. So, you know, spread the information that you have and the tools that you have. Try to spread them widely so that everyone will be reached. Yeah, I think that's very important. Yeah.
I mean, something I would recommend to them would be, you know, work with the community leaders. I mean, in the autistic community, there are some really fantastic people who've got huge audiences, you know, people like Emma Dalmain, Krista Holmans, you know, many other people. And, you know, they've got massive respect, huge audiences. Use them, you know, get them on side and work with them as well, you know, co-produce the tips, or not even just let them produce the tips. It's best coming from the autistic population. So yeah, I think one way of moving forward positively is really going to be working with the community rather than us and them again, and we know better. You know, have some humility, work with the communities, etc., etc. We've got a few comments. I wouldn't mind just highlighting them. So Moira Sinclair. Moira is from South Africa. She's listened to a few of our live streams before. Hello, Moira. Ryan is her son. Hi, no problem. Just popping in. Hello. I hope you're not gone and you see this. Hello and good luck. Hello, Maria. It was Maria is a friend of mine. It was her birthday recently, and she's raised some money for the charity. So a big thank you, Maria, for that. Justin B. So Justin, welcome. Justine, rather. I'm sorry. Justine, welcome to the live stream. You say, thanks for this interesting video. Does the survey give you data about how people cope with the change in simple daily routines, eating, sleeping, going outside? Anything about that?
Yeah, so we did ask about that. and the autistic individual said they feel like these changes to their routines, which are inevitable because of the rules, they are experiencing more difficulty with it. But at the same time, it's kind of going two ways. So they do experience the difficulty that suddenly they have to change their routines. But we also heard quite a lot that it opens up new opportunities. So because now they can kind of structure it in their own way, in the safe cocoon that is their own home, they are kind of experiencing the freedom to adjust their eating, their sleeping, their basically everything, their daily routines to their own needs and preferences. So that's actually a positive thing to highlight, that maybe the fact that now we are kind of forced to change our routines, it opens up some possibility to really make those adjustments, really fit your personal preference.
Yeah, because in this time we can kind of deviate from society's expectations, which is nice to have a bit more extra freedom. But at the same time, like Annabel mentioned, they do experience more difficulties than the other group, the ones without autism, with the loss of routine.
Okay, thank you very much. I'll move on because we've got some other questions coming in. Ria, I think this may be about autistic people, those who already have existing mental health issues. I have 20 out of 23 young people who are doing well. It has been reported that they are much calmer and happier before. I've been contacting parents on an almost daily basis to support them. Yes, as we said before, I do definitely agree with you, Ria, that in many cases there's a lot more calmness and reduced anxiety even. So I mean, I suppose that is that's a fair point, isn't it? That, you know, there could be a slight bias in your sample. I don't want to criticize your research or anything, you know, but it could be that, you know, people may have sort of wanted to complete, you know, people who sort of really frustrated and wanted an outlet, perhaps wanted to complete your study, and perhaps, you know, the number isn't quite as high as 3/4. But even if you factor in that bias, let's say there's a 40% of the population, which is a conservative reduction from 75%. That's still really bad, you know. Even if it's 30%, it's really bad. So either way you look at it, whatever, I think even with when you factor in the bias or not, and it, to be honest with you, it's what we're feeling as well, that actually a lot of people are struggling with anxiety and depression. So it sort of validates what you found. So, you know, it's a real problem either way. But yeah, it's great to hear when people are doing well. Maybe it's in part because, Ria, you're supporting them all the time. You know,
that does sound great. Yes.
Yeah, so good for you, Ria. You're doing a good job. Please give me a call as well, Ria. That'll be nice. Okay, so we've got another comment here from Samantha Osborne. I think that the community needs to be encouraged to be kinder and more aware of how vulnerability doesn't fit a certain image. My biggest stressor has been the perception that people have become aggressive when attending the store. I was encouraged to go in the early hour by staff at the shop as my milk delivery was cancelled. I felt judged and overheard an older lady in the queue questioning why young people were being allowed in. A whole new social code and culture. That's scary. Thank you for doing your research. It was great to have an outlet and to feel listened to. Yeah, thank you so much for Samantha. That's such an interesting comment. Would you like to say any comments on that?
Well, thanks for the feedback, and really privileged and honored in a way, I guess, to hear all these personal stories. And it's such a strange world, and I guess we are all feeling that. And I think very important the message to be kinder and less aggressive and to just listen to each other. That's very important. Yeah, definitely. I don't know if you want to add anything.
No, you said it perfectly.
Yeah, and I think Samantha is also highlighting the importance of the lack of awareness still about the invisible nature of autism. So there's still a lot of work to do in educating people
Yes.
that are still judging people about and questioning why some people are, for instance, even before the pandemic, they're questioning whether some people have disability permit to park their car, in a certain place at the supermarket, things like that. And it sounds like that was the case in Samantha's case as well. Why she was allowed in before the other people.
Yeah.
Yeah.
Yeah. We need more awareness.
Yeah, absolutely.
I think from the open questions, we heard a lot of people say, like, I hope more awareness comes now, because some people feel like now people finally, like the non-autistic community, finally kind of feels what we are feeling on a daily basis. So the social isolation, and they were kind of feeling more in line with society. There was a really beautiful quote we put in the report. Let me see if I can find it. So can I quote it?
Please do, please do.
As the entire nation is in lockdown and everybody is self-isolating, I feel like I'm finally at one with society. My way of living is the norm. I no longer have to feel alone. I have a sense of belonging, that everyone is in the same situation and we're all in this together. And I just thought that it was a very beautiful quote, and I think people really hope that there comes more autism awareness, and now some people kind of feel like there's more solidarity in this period of time.
We had Kieran Rose on a few weeks ago on the live stream, who's another, I should have mentioned his name earlier. He's another really well-known, highly connected, highly respected autistic community leader. And he was making the point that, that exactly this, really. He was really sort of saying that people now understand what it's like, almost, for autistic people. I mean, we're always on lockdown in some respects. We're always self-isolating and living with the anxiety of unpredictability of life and what next, etc., that the wider population are now experiencing. So there was some sort of kind of feeling of comfort, knowing that others perhaps understand, that, or living at least in their shoes and getting it now. But the point he was making, which I think is really, really even more important, is that, okay, we get it, but we need to do something about it. We can't just sit with the knowledge of it. We need to now use this as an opportunity to leverage the fact that actually the wider population now get perhaps the autistic experience a little better, can appreciate it and perhaps, understand it a bit better. And we need to sort of strike while the iron's hot, as soon as there's the next opportunity, use it as leverage to really push on with boosting acceptance and understanding and reducing stigma. That was his point. And I think that's, that sort of links in with Samantha's comment, because in Samantha's comment, it's clear there still is loads and loads of stigma and judgment, and it's the last thing that Samantha would need, right? I mean, she's, likely to be feeling particularly anxious about shopping, in line with your findings. She's gone, this into the early hour time, because she was, there might have been anxiety that it may not have even been happening, as per your point earlier. So there's a lot of anxiety and stress goes in, and you feel judged. I mean, you're not even in her case, it's not even feeling judged. She overheard it. It's experiencing it directly. It's and we call it in research, we call it, there's one thing called felt stigma, when you feel it, and there's another thing called enacted stigma, where she experienced an enactment of stigma. And that's the last thing she needed. So there's a real problem with stigma, and we can hopefully leverage the situation that we're in at least as positive way as possible to get some understanding and reduction of stigma going forwards. That is the key thing, I think, if anything's going to come out of this.
Yeah, yeah. I think that's the, yeah, I don't know, like the fuel that keeps all of us going in this time, is that hopefully we can learn something and use it for the better. Yeah, more awareness, more support, and yeah.
Thank you, Ria. Fully agree. Moira has just added, with my residential home. So Moira is a manager of a residential home for children, and I thought young adults with learning disabilities, and aren't, as she says, they're not verbal. With the hard lockdown, they had to remain in the home on the weekends as well. We eventually took the decision to allow them to go home on weekends as their mental health started to really show some cracks. After going home on the weekends now for the past 3 weeks, I'm starting to see a great improvement in all of them again. Well, I'm happy to hear that. That's great. And there's nothing more important than mental health. So, that's great. Great that that's happening. Back to Ria. I have been emphasizing the importance of maintaining the routines and visual timetables. The main source of anxieties is not being able to be in control.
Yeah, that's I think an important point, that where you can stick to routines, it's probably great to do it, because there's so much that is, as you said, unpredictable, and so much that has already been changed or taken away. And yeah, I think that sounds like a very good advice, to stick to certain routines and maintain the control, and yeah, get people the feeling that, a lot of things that we are currently not in control of, and we have to probably let those go, for we can't control them, but yeah, where you can, it's great to feel in control.
So yeah, I've been thinking about when lockdown does eventually finish and we slowly get back into more normal state of being again. The autistic community may benefit, because from what it sounds like in the UK at least, it's not all going to be at once. It's going to be gradual. And I think that's very important, that it doesn't all come at once and it's not too much of a shock to people. What do you think on that, Chris?
Yeah, no, fully agree. Fully agree. It needs to be handled very carefully and sensitively. And as I said, I think we need to really listen to the community, or also the evidence that comes out of these kinds of studies as well. So fully agree, James.
Yeah, I mean, we can't really change anymore what happened months ago when all of this started, but we can use that information moving forward as we transition again, hopefully. Yeah.
So to summarize, in terms of your findings, a large proportion of the autistic population and the neurotypical population as well had increased anxiety and depression symptoms. They struggled in particular with the whole shopping situation for various reasons. There were comments about, as we said before, about how people now understand what lockdown, how it feels for the autistic population being in lockdown. You talked about social isolation and loss of daily routine. So those were the key sorts of things that really, really fascinating findings. My question for you, I suppose now, and I suppose this is the key thing, what are you going to do with all this? Like, what's next? How are we going to, try and, make an impact with this crucial learning that you've got? Because it's one thing when we talk about it, do you know what I mean? You know, we're talking about it, we discuss it, but that's the sort of lowest form of evidence, you know, that's sort of very anecdotal evidence. But you've actually gone out and you conducted a really sort of scientific, well-designed survey with a very large sample of people. Okay, there's going to always be a bit of bias, but when you've got such big numbers of people participating, you know, it's usually very, you know, it's a good sign, let's say, that the results are going to be reasonably valid. So you've generated real concrete evidence. I think we need to sort of, you know, keep leveraging what you found. How are we going to do it? What's the plan? Have you got any? Obviously, this is one way of doing it, but are there any other thoughts as to move forwards?
Any thoughts? I think so. Basically, what Danna has greatly done is that as soon as we had these results, we tried to communicate them as widely as possible, and we made a little list of you know, what we think are key points. So the continued support, whether it be online or through video chat, or just at least give people an option to continue the mental health support that they had. Wider access to information and to tips and tools, assistance with the shopping situation. So those are like a sort of relatively practical points that we can use to move forward. And as I said, Danna has been contacting a lot of autism organizations, autism charities, care practitioners, and I think right now, probably our reach has been more in Belgium because we are from a Belgian university, but we're trying to communicate these key points and the results, and to, I guess, create the awareness also in the UK and the Netherlands, where our respondents came from. We will be featured on a Dutch national newspaper with the research, so I think it's also quite important that, you know, the more people are aware of this, support can be given and the more awareness can be created. So I hope that's what we do to take action. Of course, we are not in the care or in the clinical side of things ourselves as being researchers, but the least we can do is to communicate it widely and to give some key points to start with in terms of what can we do to support the autism community.
Yeah, I think it's great that you're speaking with the media. That's a really good way of doing it. You know, contact as many media organizations as you can. At university levels, they usually have their own press offices. They can put out a press release. I'd really push for that. Use media for sure, and keep contacting the community organizations. You know, just get it out there, because I think these results, these findings, they're so important. I think they deserve a really good legacy, and I hope that you get it. And
Thanks.
yeah, and in that journey, I hope this recording gets shared, as you know, many times, and gets viewed many times, because you've really described the results really nicely, and you've put forward some really important points as to how we can improve things going forwards. So big thank you, guys. Very kind of you coming on today. Oh, Ria's just added one other point. Let me just read it out. Also, anxieties can be confounded by sensory processing difficulties. Our London boroughs have not enough occupational therapists. Some boroughs have just one. They're stretched thin. Yeah, absolutely, fully agree with you there, Ria. Anxiety and sensory processing are going to be extremely interconnected. Ria, if you haven't seen our live stream from last week, definitely check that out, because we spoke with two experts in the sensory world, and you should definitely go and listen to that one, because that was talked about in great length. Actually, it was 2 weeks ago, not last week. Okay, James, have you got any other questions or?
No, I think it was pretty thorough what we've covered already, I think.
Great. Well, do you guys have anything else that you wanted to add or say? I mean, the hours just flew by. It's an hour's gone, and we usually sort of.
Yeah.
No?
Thanks so much for the
Yeah.
opportunity. I mean, this is really how we get our message across. Yeah.
Yes.
So
Thank
thanks.
you.
Well, thanks, big thanks from all of us in the community, whatever way that we identify that community, for you doing the research that you did and really trying to also make an effort in getting it out there. I think a lot of researchers are often guilty with just, you know, trying to get the publication, you know, and not thinking about impact, translating the findings into social impact. Do you know what I mean? And you guys are doing that, and I think that's really, you know, noteworthy, and thank you for doing that. That's really great.
Yes, thank you.
Yeah,
Thanks.
and getting some thanks coming in from the audience as well.
Thank you.
So I think it's been really interesting. Great. Good luck with everything. Keep safe. Stay well. And
You too.
thanks again for making the time.
All
Thank
right.
you.
Bye-bye.
All right. Thank you. Bye-bye.
Thank you.
How does